Um, Welcome everyone. We're very glad that you made the time to join us. We have today Dr. Cariappa, who is from India, and the Armed Forces. He's an alumnus of the Armed Forces, the Medical College at Pune in India. He's a medical doctor who has done some work in combat medical support settings and a tour of duty. He has a public health practice and a graduate degree in preventive medicine. He is currently an assistant professor of the Maharashtra University of Health Sciences, and he lectures in education, behavioral change, communication, military preventive medicine, and mass gathering medicine. He is today presenting on a worm's eye view of the public health aspects of managing a mega mass gathering. And I don't know how to pronounce Kumbla Mela, am I right?
Yeah, it's Kumbh Mela. Kumbh
Mela, a religious festival of huge proportions, attended by more than 120 million pilgrims in India, and this happened in 2013. So he's going to present us with this case study, and we really look forward to hearing what you have to say. Thank you for joining us.
Good morning and a good afternoon and a good night to all of you, ladies and gentlemen from across the world. You're all in different time zones, so I hope those who are in the side of night do not fall asleep. I'm just going to be talking to you over the course of the next 45 to 50 minutes about this Kumbh Mela 2013. It is a case study we prepared on the public health planning aspects of such a mass gathering. Over the course of the next few minutes, I will try to explain to you why this is a mass gathering and how it is humongous in its proportions. To just give you a brief background on what is this Kumbh, so I call it Kumbh 101, the mythological origins of the Kumbh Mela can be traced back to the pre-Vedic era. That's about between 500 to 1500 BC, in the time when the Devas, the gods, ruled the heavens and the Asuras, the demons, coexisted them. They, of course, as gods and demons are wont to do, had a lot of conflict now and then. This mountain you see in the center was the mountain Mandara, which was used for churning of the ocean to come up with Amrita, the nectar of life, because the gods and the demons both wanted immortality. There was this snake, a huge snake called Vasuki, which, as you can see in the slide there, it had many heads. It spewed poison as it was being used as a churning rope. And this poison that was being spewed was on the side of the Asuras, the demons. And this poison was swallowed by Lord Shiva. His consort, Parvati, held his neck, and hence he became blue. And this is why the name Neelkantha, blue throat, has come about for the Lord Shiva. Some say that Lord Vishnu, in his form of Mohini, stole away this Amrita, the nectar of life, the nectar of immortality, in a pitcher, Kumbh. Kumbh means pitcher. And through his winged transport, Garuda, escaped the clutches of the demons, the Asuras. A few drops of this nectar of life fell from the Kumbh, the pitcher, onto various locations in India, the subcontinent of India. As you can see on the map, Nashik, Ujjain, Allahabad, Haridwar. And just to share with you, these are the most populous regions of this subcontinent. Right from times immemorial, these regions are where the maximal concentration of humanity has occurred through civilizations. Now, what is this thing about? Kumbh Mela. It is about faith, ultimately. As you can see from the biblical quotation on faith, it is the power of faith and hope. People always like to believe in something that's bigger than themselves, bigger than their own lives, bigger than the society that they're living in. It is something that has been inexorably drawing people into this vortex of religion, you could call it. Many people believe that a dip in the holy Sangam, I will explain what that is about, will wash away sins and help an individual to attain moksha, that is, liberation from the cycle of birth and death. So as you can make out, it requires you to believe. It requires you to have faith. And in a subcontinent which is ravaged by weather which is ravaged by drought, which is ravaged by invaders. Across the centuries, it is faith that has kept people going. Sangam in Sanskrit means confluence. Here I am giving you a view of the fort built by Akbar, a Mughal emperor, to dominate the region or the area where the Mela, the Kumbh Mela, Mela means festival, where the Kumbh Mela was held. Here is the Sangam. Sangam again means a confluence, like I explained to you. This confluence is particularly sacred because it has the Yamuna, the Ganga, and the mystical Saraswati, which you cannot see and you don't know about, but it is merging in the center here, and or so people believe. You can make out the difference in colors of the waters, the muddy Ganges with the darker green Yamuna. Have a look at the kite's eye view, where you see the congregation of boats in the center clustered there. That is the holiest site as per Hindu belief. This is the site where the three rivers meet together, and this site is the holiest. And if you bathe in this site during this season of the Kumbh Mela, which comes once in 12 years and once in 144 years is the Maha Kumbh Mela, then your generations and generations of your sins are washed away and you will be liberated from the cycle of birth and death. A satellite view of the same site. The whitish area you see are the floodplains of the rivers which get inundated with the monsoon fury and which in the rest of the year are above water level, and there you can build the city that comes up every 12 years, the Kumbh Mela. Giving you a flying cam view, giving you a view from the British era, the fort itself. This was the banks of the Ganges where the festival was to happen. The Maha Kumbh Mela in 2013, the Guinness Book may be saying something about it, but we all know that it is the largest ever gathering of human beings. Can you just imagine 120 million people gathering there? And as in everything in the Indian subcontinent, I'm certain the next edition of it will be even bigger. So maybe we'll be looking at 150 million people gathering together there. The numbers do add up. If you look at the various bathing days, the most auspicious bathing days, just to remind you of this, it was held over a period of 55 days based on astrological calendars in the months of January to March of 2013. And these days are the holiest days when people, when they bathe on these particular days, will be given a higher level of moksha. Maybe that's what the belief is. And as you can see, the estimated attendance is in millions. You've got millions of people converging on just maybe a 3-kilometer riverfront and immersing themselves in the river. It is cold. When we had visited this thing, the river water was cold. Just imagine, you are sitting in suburban bliss. You are about to settle down for a nice light supper with your family, your loved ones, and you find that your neighbors decide to call on you. You find that your neighbors come and say, let us join you in your supper. Then the neighbors call up their friends, and the friends call up their friends, and their friends call up their friends, and likewise you have, let's say, the entire city of New York coming into your house, or Sydney coming into your house, or London in your house, or the entire country of Japan coming in visiting you over the course of 55 days. And that, ladies and gentlemen, was the Kumbh Mela 2013. 120 million people estimated to have attended over 55 days. Just imagine the stress on the city, the original city, not the temporary city that came up to deal with this. So what I'll be covering and talking to you is just about this. What is a mass gathering? We all are aware that conventionally we talk about mass gathering being more than a specified number of people. Usually we say 1,000 people to more than 25,000 people at a specific location for a specific purpose and for a defined period of time. We all can deal with 1,000 people, maybe even feed them for 55 days, but can we deal with 120 million people? So, well, research and definitions are being changed, and I sort of like this definition by an author here, that events attended by a sufficient number of people and of sufficient duration to strain the planning and response resources of a community, a state, or a nation. Now that is exactly what we're looking at in this Kumbh Mela, going by the data that I've already showed you, the numbers that were estimated to have attended. Now from the military point of view, mass gatherings essentially are very similar to operations of war, where you assemble as a conventional war. You assemble on one line and then you want to launch an operation or you're defending a thing. It's a mass military gathering. Or you have a disaster situation. Usually the armed forces in every country are the ones who are the last resort for any government to deal with disaster situations, to deal with refugees, mass migrations, internally displaced persons. You had it in Rwanda. We had it in 1971. We had it in Bangladesh, erstwhile East Pakistan, almost came and sat down in West Bengal. Now, these are situations which public health professionals in various streams, be it civilian or will always face issues about. So we have a definite stake to learn more about this. Institutional memories. Now, do we have such a thing as institutional memories? In the West, it might be easy to say that you've got these manuals, you've got resources, but when festivals like the Kumbh Mela are held every 12 years, in the life cycle of a government employee or the life cycle of a care provider, how many such events would you be able to attend? How many such lessons would you carry forward? So there is a tradition in India. We have the oral tradition where we tell stories about events, we tell stories about happenings, and this is carried on through generations from word of mouth. Does the Kumbh Mela have historical precedent? How long has it been going on for? Or is it just word of mouth? Documented history just traces itself back to about 2.5 centuries. But in the minds of people, it transcends history. What is it that has been passed down? So as a result, now with modern technology coming in, we are hopeful that by discussing things like this on this forum, and do note that we are a developing country, we are getting there. We will be able to do the same or parallel or even than maybe the Western world. But right now we are still in the nascent stage and we are working on it. So institutional memory is being progressed, institutional memory is being developed, and there are tomes being written on this thing, and the carry forward knowledge is being shared within my country. The key players on the ground here. Here we have Dr. Dwivedi. Dr. Dwivedi was one of the stalwarts who was there on the ground. You would never hear of these people, the men on the ground, the men who led from the front. You would only hear from people who have been at the highest level. But now I am giving you the view, like I stated in my abstract, the worm's eye view, right from on the ground level where the action is happening. So we had Dr. Dwivedi, a doctor doing his routine medical practice work in the government system, and suddenly in September 2012 he is pulled out from his routine life and told that you will be in charge of the health, hygiene and sanitation of this entire temporary city that's coming up of catering for 120 million people. You will have to supervise anywhere between 30,000 to 50,000 people. Now how does a doctor do that without any formal training? And yet Dr. Dwivedi and his team excelled in what they were doing because they believed in the concept of team building. They believed in the concept of a bottom-up approach rather than a top-down approach. The next stalwart, Major Sahib, VP Singh. That is a term. Major is a rank and Sahib is a term we give with respect to some esteemed person. And Dr. VP Singh is a medical doctor. He had a short service tenure in the Indian military, and he utilized the lessons that he learned in the military tenure in his tours of duty. He utilized all those lessons that he learned, the experience that he had, to effectively deliver health care to all the people that attended. Now, can we have an event of this scale without having any rules and regulations? The law of the land. There were various acts enacted, most of them pre-independence, but modified subsequently through amendments to regulate how these melas and these kind of events are held. Now this, by having a law, it gives you authority. It gives you a template on which to function. This is also defense land. As I had stated earlier when I showed you the photograph of the fort, it is based on the floodplains in front of the fort. It is said that these floodplains were kept vacant because the British wanted to have a clear firing field in case there was an uprising. Because this formal organization of the Kumbh Mela actually started after the 1857 First War of Independence, so to say, or the Sepoy Mutiny as it was also called sometimes. The land itself, you can just have a look, the floodplains again. This just shows you that before, on 18th December 2012, this is how it looked like. And thereafter, in the subsequent slides, you will see photographs of how this tent city sprang out of nowhere, literally. as in every administration, you have to have a single point of contact, a focal person who is in charge of every administrative aspect, the person you can refer to. So too, there was a bureaucrat who was made full-time officer in charge. There was manpower pooled from across this entire state of Uttar Pradesh, which is one of the largest states of our country, with the largest volume of land and the number of people. All categories of personnel for this Mela, the festival, were on full-time detailment. There was no part-time work for anyone. You handle this, you handle that. It was full-time detailment. The administration, the police and firefighting personnel, and the healthcare personnel. Budgetary allocation. While for you in the Western world, these figures might seem quite trivial, in Indian currency, it does translate to a lot. But what I am trying to illustrate here is just that there was adequate budgetary provision made, and there was more forthcoming if it was required. There was no stinging on any monetary allocation that was required. And on the right, I've shown you the budgetary allocation statement. There were various factors considered for population estimation and resource planning. They based it on the 2001 information, and they made estimates for 2013 about how much would be the attendance, and based on the entire population of the region and the anticipated population, they planned resources being allotted. There were 1936 hectares of area was allotted. There were 14 sectors that were made. 156 kilometers of roads were laid specifically for this festival. And like I said, on the floodplains, all of this is transient till the next monsoons. Right now, the monsoon season is on. So if you were to go to Allahabad, you would find the floodplain flooded. There were 99 parking lots and there were 18 pontoon bridges. Complexities of scale. Such a humongous gathering could only be addressed by dividing this temporary city into organized and relatively self-contained sectors. For administrative and functional convenience, this was also a synergistic network which was interconnected at every level. There was professional town planning done. There were 14 circles which were self-contained for law and order, and healthcare was planned as per sectoral distribution. But for hygiene and sanitation, there were 22 circles for better administrative control. You can have a look. Our cities in India are not as neatly laid out as these sectors and roads were. Straight lines, as far as the eye could see, straight lines everywhere. The tent city, a view of it. If you notice right in the foreground, there is a yellow balloon. If you can see that clearly, I will talk about that a bit later. For the rich man, you had luxury, if you could afford it. For the poor man, you were down to earth. The common man who visited, mostly common men did visit. For the common man, it was down to earth at the ground level. 10 to 20 people sharing a small cramped space. The weather at this time of the month is usually very pleasant. Pleasant from Indian standards would mean ranging between 18 to 22 degrees would be the temperature. And at night, it might dip down to about 12 to 14 degrees Celsius. Electricity. There have been complaints or criticisms about the amount of electricity that was consumed, but a specifically designed network of power supply was developed for the Kumbh Mela, and over every edition I'm certain the power consumption is going to increase because we are a power hungry growing country. There were no power cuts. In India we have a term called power cut. There's no such thing as an outage because we regularly have cuts. In this city you can see the lights never went off. It was like a city that never slept. All the lights were on because this itself, having lighted areas, provided security and a sense of safety. Healthcare facilities, coming to that, there were 14 allopathic hospitals mirroring the sectors that were there, so it was a geographic distribution. There were 100 first aid posts. Number of ambulances were pulled in from the various state resources. There was GIS mapping based on the concentration of people. It was fully staffed as per the requirement. They had a central hospital and sectoral hospitals to detain patients and to refer patients. And there was no intention to provide full-time care within the Mela area. It was intended for first aid and emergency first aid to be provided and thereafter evacuated to the existing static hospitals within the main city of Allahabad. There was a standard design and layout for all the healthcare facilities, and a departure from the past. Prefabricated structures were made with a standard layout everywhere across the Mela. There were adequate signposting, there was registration, there was an outpatient department running, there was inpatient segregation, males, females, and yes, even a VIP ward. Like I said, we are a developing country, we have to have these segregations that are there. Dispensing of medicines was done. There was all medicines purchased for the Mela to prevent leakage into the market or black market had stamps put on each strip of medicine so that it would identify it, the source of it as being from the Kumbh Mela. Biomedical waste also attention was paid to it. Every little aspect was thought out in the planning by the medical professionals at that point in time. Morbidity data. There was a daily reporting system and healthcare facility records were paper based, and they used to pass this information to the central hospital on telephone or mobile phone every day in the evening. At the same time, while the Mela was going on, there was a study team from Harvard University which collected data using iPads, and they have presented it various places. And now, to be straight about it, they have implemented it in partnership with the government of Maharashtra in the Nashik Kumbh Mela, which is a festival of equivalent magnitude, however, on a different pattern in just the last year in 2015. And as per reports, it's been highly successful. The usage of mobile technology in collection of data on conducting of health surveillance. But in the Kumbh Mela that I am talking about now in 2013, it was still a paper-based health reporting system. Approximately 5,27,818 patients were seen in the OPD over the duration. Air evacuation was done for 8 casualties. There was a cylinder explosion, a gas cylinder exploded, and referrals to other hospitals happened in 953 cases. You can have a look at the OPD pattern. There were accidents were not that much of an issue. There was no incident of stampede despite so many people coming in. Respiratory tract infections, given the weather conditions and the conditions of overcrowding, were expected and were at the level that has been shown here, 65% of the pattern that has been seen. There were only 7 deaths during this period, 7 deaths in hospital. There might have been many more in the environment because mostly elderly people come for these kind of religious events, and if they die, there might have been no formal reporting system for them. There was malaria transmission also that was occurring, which was unusual given the weather that was there. There were just 2 women who delivered during this period. The private sector too participated equally in providing healthcare. The government was the backbone, and there was also permission given for private charitable institutions to set up their own healthcare facilities for their pilgrims and those who are their followers. Ambulances were pulled in from across the state to provide those 127 ambulances spoke about, because the key aim of the organizers was to ensure speedy evacuation to the health posts and thereafter to the ambulances. Now you might wonder, how would these ambulances move within such a crowd? Crowd management, crowd movement was a key area of concern for the organizers. The police had dedicated lanes for this. A unique concept. Now, if people are going to go and bathe in a river, if someone has a drowning incident or a near drowning incident, to get them through the crowd might be difficult. So this time, the doctors came up with an idea of the river ambulance. They faced the crowd on the river banks and were all hovering there on the sides to pluck out from the water anyone. There was a doctor available, a diver, a swimmer, and 2 ward boys on each boat that was there. Disaster preparedness was planned for by creating kits in labeled cartons and distributed at various sites, catering for these 4 eventualities: drowning, burns, stampede, and bomb blasts. And these were distributed all across the festival area. You can just have a look. These are the size of the cartons, easily carried by each man. You can lift it, listing the medicines that are there on each. There were various quick reaction medical teams, water ambulances, first aid posts, and there was a police hospital too. The unique, another aspect, in the first time it was tried out here, we had motorcycle-borne firefighters who were carrying cylinders, fire extinguishers on their backs, who could go thread their way through the various lanes and by lanes and reach the micro fires that might come up there. Water was supplied. We were on the banks of the river, the 2 mighty rivers of this part of the world, the Yamuna and the Ganga. But still, this water would not have been safe to drink, though religious fervor might have made people drink. And just for your information, Ganga water is sold bottled because of its properties. 80,000 kiloliters of water was supplied, portable water was supplied. 550 liters, length of pipeline in kilometers was laid down. There were 20,000 connections, 40 tube wells, and 5 huge overhead tanks to cater for the water supply for this festival area. This chlorination apparatus you see behind you, the one in blue, it is a bladder chlorinome. Now this is one that supplies bleaching powder solution or a hypochlorite solution into the pumping system. Usually in our country it never works anywhere, but miraculously it was fully functional. In fact, for the students that we had taken along to have a look at these things, it was a real eye-opener to have seen a functional chlorination apparatus. The people who organized it, the key working force, had gone through a team building process, and it was a matter of pride for them to project it. All is not good, in case you're wondering. There were public drinking water points sponsored by various companies. For example, AquaGuard, Eureka Forbes had sponsored one such point, and they were across the thing. And you can see people actually verifying whether there's an equipment there or just a pipe connecting it. There were public taps. These are all prefabricated roundels there with water draining out, and there was no issue of water stagnation because it was a sandy bed. All the water would percolate through to the ground. Water bowsers were clearly marked. What it says in our local script is that this water which is there in this tanker is not fit for drinking. But you can see still, despite it saying in red, bold highlighted, you see one lady there who is walking behind it collecting water to drink. So this illustrates the gap in the knowledge, attitudes and practices of the millions of people who attend there. Surface water drainage was arranged through temporary surface channels. There was adequate slope being provided, and these all would go down to percolation chambers at various points. There was surface water drainage. These all converged in these reservoirs and were allowed to percolate and were periodically pumped out and watered the roads. As we are all aware, with sand, we might have watched the Spider-Man movie where he fought the Sandman. We all know that sand has unique properties. You wet it, it becomes firm. So this is what they were doing for the roads. Bathing arrangements were mostly ad hoc and temporary, but there were adequate bathing points provided. Prefabricated concrete sinks were used throughout the festival to decrease the cost. Bathing ghats. On the river banks, it was calculated how many people could be accommodated and how they could safely be accommodated. If you have so many millions of people coming and bathing on the peak days, you need to ensure that the water is relatively safer, relatively slower moving than it might usually be. And this was done through a regulation of the water flow of the rivers, through the control and titration of a series of barrages upstream of Allahabad, upstream of the Sangam. The water flow usually is said to be, if it's about 2,500 cubic feet, it is going to be slow enough to be safe for people and fast enough to move away pollutants from that area. During the period of the festival, industrials were also requested not to dump their effluents. Yes, it does happen in India, as in many other countries. And the Clean Ganga campaign is really getting active now. And this Kumbh Mela was a focal point for the Clean Ganga campaign. The government of India has now taken it on in a big way. But getting back to the bathing ghats. Now, if you see here, you got a steep slope. How do you keep it safe for the pilgrims? The extensive usage of straw and sandbags. So there was no messiness there. There was no slush that was being formed. All people would come out dripping wet, drip onto the straw. The straw would dry through the day, and every week or so they would change the straw. So it was very clean. There were even boat-based VIP bathing cubicles. You could take your boat to the middle of the Sangam, the confluence of the rivers, and there pump the water up and have a shower right there with holy water. Gain your moksha on a boat. The waste disposal system had waste bins, waste collection points, on-site sanitation, municipal landfills. It was very smoothly coordinated. We did it. Our doctors did it. Dr. Dwivedi was the man who was supervising this entire hygiene and sanitation operation. Just imagine the number of people who were staying there, and a temporary site that too. It was 14 Mela sectors, 22 sanitation circles. There was a circle medical officer in charge, a chief health inspector, sanitary inspectors, sanitation gangs, sanitation workers. On the lighter side, each sanitation gang had about 11 to 12 members, and the big boss of the sanitation gang and his wife, she was literally like the mother of that team. She would cook for them, she would wash their clothes, and they were like her children. And this gang was the last functional unit on ground which was doing all the cleaning. There were 22 medical doctors who were in charge of this hygiene and sanitation drive. As you can see, the gangs I'm talking about, mate and his wife, they were the pivot. You can look adequately signposted in big huge letters. It says Kuda Gadda means this is where you dump your refuse, your garbage. Look at the cleanliness, and this is just a random shot taken. Sweeping would happen 24 hours of the day with special attention. When there is a huge crowd, every dustbin was emptied regularly like clockwork. Garbage, 10104 tons of garbage were taken away from this area and disposed of in the municipal landfill. And why I have highlighted the covered? Usually in our cities we have open garbage trucks moving around with garbage flying here and there, but these are all covered because it was stressed on hygiene. Coming to toilets, 34,262 individual toilets, mobile toilets, trench toilets, but can we take away the habits of people? Open air defecation still did happen, but was not officially encouraged or permitted. The hygiene and sanitation staff had devised a system of carrying slate lime in a basket, and wherever they would find feces, they would just go shake their basket on top of it. You can see a boy there pointing out the various minefields, as we like to call them, of people having defecated in the open. Malathion was sprayed on liberally, and slate lime was used for covering pits. Bulldozers were used for clearing up these open defecation areas. Otherwise, there was gender segregation. They had separate female toilets and separate male toilets. Mobile toilets were provided. High-tech toilets were also tried out there. Various patterns and designs to see what would be effective, which would use less water, which would have less smell. All of these were evaluated and tried out by various agencies, including the government sector, during this Kumbh Mela. Going by the number of liters and the tons of chemicals that were used, it was no wonder that it was literally a vector-free festival. I would say that literally the vectors were drowned in the chemicals. Now, the environmental impact of this, I guess we should not be talking about it, but there might be an environmental impact in the future. But as of that time, there was no disease outbreak, there was no vector-borne disease outbreak during the Mela, and it was very proudly stated, correctly so, that it was literally a fly-free Mela. Coming down to disposal of hair, as part of every religious festival, there is an amount of hair that needs to be shorn. People need to get their heads shorn of hair. 2,880 bags of hair, each bag weighing about 100 kgs. You can just imagine, it's a wig maker's paradise. Vector control, there was an anti-malaria officer in charge. They had vehicle mounted foggers, and daily thermal fogging was being done. All garbage sites and latrine areas were sprayed daily, and the government emphasized on it being a flyless Kumbh Mela. Kumbh Mela indeed is a congregation of the devout. There were bhandaras. Bhandaras is a place, it's a religious site where the poor are fed by these religious people, and they are given meals seated down there, and they are thankful to these religious leaders for giving it. And that is how these religious leaders acquire their followers. So there would be competitions between various religious leaders to acquire more followers. You feed them, they follow you. Here you can see them lined up, and you can imagine that food safety would have been an issue. It might have been an issue, but well, there were no outbreaks. The morbidity data doesn't reveal any such trend. Crowd management was a major issue, but it was planned. There were channels, crowd turbulence was studied, crowd patterns of movement were studied, and there was very active visible policing being done to make sure that crowd movement happened, especially on the peak bathing days. Public service messages, the government did utilize every opportunity to pass public service messages, but contrary to what the Western world might think, was not an opportunity for the government to conduct behavioral change communication campaigns as such, because people have come with a different agenda, a different motive. It's religious fervor here at its best, and so subliminal messaging was what was resorted to. Appeals, here it says, you save the Ganga, be good to the Ganga, because this is what you are come here to worship. So don't throw polythene or plastic packets into this river. So it is just trying to give these kind of messages. However, there was still sensitization campaigns carried out at a low-key level so that it did not distract people from their primary purpose. This is a campaign talking about the girl child, about how the girl child is important for our society. Signposting was adequately budgeted for. Everywhere across the festival site, signposting was seen in adequate quantity. The Clean Ganga campaign was sponsored by the religious leaders themselves. The government has its own initiative, but even the religious leaders sponsored most of these activities, and it was relatively clean compared to its usual state, the river Ganga. Gender issues were thought about in this festival. There were separate toilets and bathing areas, separate changing areas, separate lost and found areas. Now this comes down to this yellow balloon. If you recollect, I had earlier mentioned about this yellow balloon you could see. In a festival of this magnitude, a gathering of people with millions of people being there, you would assume that people would get lost. Mothers would be separated from their husbands, children from their parents, parents from their children. And what do you do then? Every sector had this big yellow balloon which had a lost and found section directly under it. There would be volunteers there along with the police presence. There was a system of video recording the person and transmitting it across the various lost and found centers in the festival area. And all you had to do was, in case you got lost, you headed towards the balloon which you could see floating in the sky. And if you were looking for someone, again you headed here and you found your loved one by this means, by using telecommunication, by using television screens there to broadcast across these various sites. And nearly 120,000 people, and this is an anecdotal figure, were supposedly lost or misplaced, and only 30 or 40 could not be reunited and had to be handed over to the police for further action, which is remarkable. There was a very innovative technique. This is an Indian bread, the chapati, which you might eat in an Indian restaurant. Now, one of these top companies which sells fast-moving consumer goods, which makes Lifebuoy. It's a soap which is very commonly used in rural India especially. So they made a stamp, an electric stamp, to stamp on each Indian bread chapati being served at the bandaras. So when you're eating your meal with this Indian bread chapati, you see this message that is there in the language that you can understand. So it says, the message very simply says, have you washed your hands with Lifebuoy today? It is promoting hand hygiene. Coordination was done with the police extensively. There was visible policing throughout the festival. In fact, to the extent that it seemed like mostly might have been a police festival. You can see nearly 15,000 people to 20,000 policemen were there on site throughout the duration of the festival. There were mock drills conducted. Safe passage drill meant that a convoy of ambulances escorted by police through dedicated, designated lanes which were barricaded off from the regular pedestrian movement to the river banks was done on a regular basis. The healthcare system was actively involved. All the ambulances were given these route charts of how to access. There was GPS being used at all points in time. Innovations. Roadways were made using steel plates, as obviously this is a temporary city. You cannot tar the thing, and it's a floodplain, so it is all sand based. So steel plates were used, and these nearly 160 kilometers of these plates were used throughout this thing. There was constant public address being done through various public address systems with volume leveling depending on the crowd volumes that were there. So what did we learn from this thing? The team that we had taken there on site to study it, we learned that town planning, spatial and temporal distribution of the crowd to reduce cluttering is most important. Division into sectors and circles may seem nice for administrative convenience, but functionally we need to analyze how this will assist us. And it goes without saying, we all would agree and understand that if advanced planning is not done, sometimes years in advance of a regular festival or a regular event, it will fail. Multidisciplinary. It has to be per se. It is not just about public health specialists or professionals dealing with it. It is interdisciplinary. The police, the administration, the law, everyone is involved in it. And comprehensive attention to detail is what is required. The broad themes for preparedness, like I said, we are not talking about theoretical approaches. It is deconstruction of what actually was done. Risk assessment, surveillance, and response. Ultimately, you have to deliver. Anyone organizing such an event has to deliver. Risk assessment has to remain a continuous process. It cannot be a desktop exercise only. It has to be continuous and ongoing. Risk assessment must include of how the public health system, the general healthcare system, and the broader community will cope or can cope with increases in these disease risks that are posed to such events. To quote Dr. Dwivedi, it's not a big job, but it certainly is a big challenge. I mean, I would definitely say it's not only a big job, it's a tremendous job that has been done on ground. The curative health services with its multi-tiered approach, the three-tiered functioning of the hygiene and sanitation services, the concept of outsourcing waste disposal, of knowing your own limitations is what's important. Resource allocation needs to be done at the highest level of state government, taking into consideration all stakeholders' viewpoints, and reallocation of resources needs to be done, that is interim corrections for whatever actions that are required. Manpower needs to be dedicated. Full-time dedicated manpower is essential for any successful program to be conducted. This may not be available with a government locally, but it can be pooled across with exclusive tasking. And there should be no dual tasking. We are very wont in India to say, you do this and you do that also. It should not happen. Dual tasking always divides a person into two. Incentivization might work a little bit, especially at the lower level of the hierarchy. At the higher level, it's a higher incentivization. It is about your moral and your ethical standpoint. As can be brought out, hand-picked personnel at key appointments. The hygiene and sanitation aspects, the healthcare aspects were all dealt with in the Kumbh Mela by hand-picked personnel who were thought by their higher-ups to have the capability to deliver, and they did. They need to develop synergy in functioning. Each cannot function as an island in excellence. And what we learned was the win-win model. Everyone should win when you're dealing with the men on ground. And a top-down approach for leadership might sound like a management lecture. It's not. It's about leadership begins from the front. Emphasis on team building with feedback being consistently obtained from the ground workers on real ground situations that are happening. Media management with social media, with the print media, with television, in your face at all points in time. It needs to be delegated directly to the ground workers also. You cannot have single points of contact because the media does not follow rules which we would like them to play by. Individual leaders at lower levels need to be empowered, need to be oriented, need to be trained to communicate appropriately with the media, especially in the event of a mass casualty or a disaster situation, so that there is uniformity in response and there is crowd management being done. Intersectoral convergence. The key aim, what we could derive on our lessons from this festival, the government, the private sector, the common man, everyone said, let us facilitate the pilgrim to have a happy experience. And all of them were working towards this common goal. So the key lesson I bring out here is, it's important to have a common goal. And in this case, it was very simply facilitate the pilgrim to have a happy experience. Political commitment. The Chief Minister of Uttar Pradesh was at Harvard, and maybe in the last year, and he expressed how the commitment was given. And such a big functionary himself, when he's talking about this, it shows the level of commitment. We should not read anything else into it about elections being up, about votes being gathered. It is about delivering what is required. Good governance is about delivery on ground, and the common man is the best judge of that. Community participation is essential. We talk a lot about it, but do we actually interact with them? The people who are doing things on ground. In this case, it was the religious leaders. public-private partnership was required for outsourcing of solid waste management, for setting up of this temporary city from scratch, from sand to back to sand, with a city thrown in between. There is a book by Harvard University, very interesting book, which makes for very interesting reading, which has brought out certain lessons that are there. And the lessons are broadly those what I've covered earlier. One of the negative parts of this event, it's been highlighted in the media, post-event, maybe stress and emphasis needs to be laid down on the clearing up operations after an event, on the mopping up after an event, on the environmental impact assessment after an event. Specific budgeting, specific manpower, maybe outsourcing it within a specified time frame. If you go today, as on date, to Allahabad and have a look at the plains, this is not what you will see, because the floods would have washed it out, and it's been 2 years since then. Maybe we need to telescope our cleaning up and mopping up operations into a shorter time frame rather than, say, 2 months or 3 months. So that way, the media glare, which likes to highlight this as a failure, will cover up all the successes that were there. And this is just a passing phase. Scales of time, scales of importance, and scales of priority in developing countries are different. It was intended to make the pilgrims visit a success. It did happen. It was intended to clean up, but the time frame was not tight enough to satisfy the media. Hence, these were the images that you would have seen in the aftermath of this event. But it was addressed subsequently, because it was the part of the planning process to take a month or two more than what was required to have been done. So my take-home messages, what we talk about here to my students, my undergraduate and my postgraduate students, is that public health in a developing country is no longer about simply promoting health or preventing disease. It's also about protecting health, with preparedness being the key. Dr. Melinda, I have completed.
Thank you. That was really a fascinating talk. I mean, I don't know much about this festival, but it was a fascinating overview and a very detailed overview where I definitely learned a lot. I'm going to open the floor for people if they have any questions.
I have given my email address also. Yeah.
Okay, excellent. I'll start off maybe with a question. So this is held in January, February, and it's held at the same time every year?
No, Dr. Melinda, it is held every 12 years.
Sorry, yes, every 12 years. So, but every 12 years it's held at the same time?
Yeah, the same time, generally the same time.
Okay, because I was just wondering with the Hajj, you know, because the calendar shifts, I know that in coming years, a big problem for the Hajj will be heat waves coupled with, you know, lots of pilgrims. So you don't see that this happens in January, February, March, which is winter time. This is probably less of a likely issue for you to consider in your situation.
Absolutely. In fact, it's my own reasoning and theory that maybe our religious leaders centuries back had said, when is the good weather in the year when we can have a festival of this scale? And they said, let's choose January to March. Pleasant, nice, no flies, no heat, not too much rain. Let's go for January to March. And then they made up these stories based on what the festival should be. That's my anecdotal theory.
It sounds a very plausible theory.
You see, there is less vector transmission also going to happen in this kind of season. There'll be no heat stress. No heat stress. So we don't have to worry about dehydration. We don't have to worry about heat strokes, because you just go a month later in the month of April or May, and you might literally get a heat stroke and die of heat stress in Allahabad.
Exactly, which is what they, you know, of great concern with the Hajj happening in Mecca.
Yes,
yes, which is becoming a great concern. So you didn't. I might have missed it, but it didn't seem to be there didn't seem to be any drownings.
There were 2 incidents of drowning, because like I said earlier, they had planned to have boats all along the riverfront, and the bathing depth was just kept at about 5 feet. The maximum depth till
Okay.
which bathing was allowed, they had fenced off the bathing areas with poles and chain link fences inside the river, on the river banks. So you could not technically go deeper.
Okay.
So only 2 cases, I think, were reported of drowning.
That's actually amazing if you think about the number of people passing through and you know how many people are actually entering the water. It's just
Yes.
astounding. You know, two
And
drownings out of that. That is a minuscule rate.
11 million people on the peak bathing day are entering the river within a span of 24 hours. 11 million
Yeah.
people. Just imagine.
It's really
It
mind-boggling
boggles the
thinking
mind.
about the numbers. Yeah.
Yeah.
Are there any questions? I haven't seen any questions coming forward.
People can email me, I guess. I'm in the audience if interested.
What I will do is I will just unmute people from my side. Oh, I think, hi, Usha. I think you have your hand up for a question. Usha?
Is it for me?
Yes, Usha, I think you had your hand up for a question.
Well, I didn't have my hand out, but I can ask a question if I may.
Oh,
Yeah,
if
yes,
you
Usha.
have a question, please do, yeah.
There was a mention of a girl child in the talk that I was just listening to. I didn't
Yes.
quite get the relevance to the explanation.
Okay, the girl child is basically, it's talking about female feticide is a deplorable practice that happens in some parts of the country with the socio-cultural context. When you look at it, there's a preference for male culture. So the government has been taking up initiatives over the past 6 decades in trying to educate society and change social norms to make the girl child more acceptable to society. So these are just some of the initiatives that are initiated by the government to change the mindset of people.
Thank you.
Any other questions?
So, Dr. Melinda?
I have one more. Just you mentioned that at the end that I mean you start off by saying that you know lessons learned 12 years down the track might be lost,
Yeah,
and then you ended your talk with saying that there's a book where a lot of the lessons learned have been compiled. Am I
yeah,
correct?
yes.
Yeah. So how is it? I mean, does that contain sort of guidelines for the next festival? And are there any other plans to disseminate the knowledge and the lessons learned?
Dr. Melinda, that book is written by the Harvard University team that had come and visited the festival, and they have examined it from their viewpoint, and it would still make interesting reading to a person who is interested in this field. But even our local doctors have brought out their own internal documents in public publications on the subject. And what we are encouraging them to do, I had a discussion with Dr. Dwivedi on this only, that we should upload it onto the internet and use the internet as an archive. It may not survive in a government archive, but it might be better to put it on the internet so it's open source, so anyone can access it. So we're working on that.
Well, that's really encouraging because I think you have a good you absolutely have a good example of how to do things right, and
Yeah,
you know with so few diseases,
yeah.
injuries happening, and deaths happening with so many people. I mean, obviously you know things were done well.
And the power of faith, we believed, and they believed, and someone believed, and I guess it worked.
Yes, absolutely. So it's I think it's crucial to capture those lessons, and because I
Yes,
think there's a lot of practices that can be transferred to other circumstances, whether it's developing or developed countries. I think there are
yes,
lots of lessons to be learned.
yeah, yeah, yeah. And
And
we've the yes, Dr. Melinda.
yeah, no, I just think that, you know, sharing that will hopefully prevent other people from making mistakes that do not need to be made.
Yes, absolutely. And just to highlight, the lessons that were learned from the 2013 edition of the Kumbh Mela in Allahabad were utilized in the 2015 edition 2000 kilometers away. So there was interaction at the professional level done by the government in this state of Maharashtra, who interacted with the organizers there and learnt from them and tried to replicate the lessons here. And like I said, the Harvard idea of using iPads and tablets was successful. I believe it. I mean, we're waiting for it to be published to see the actual evidence that comes out of it. So it worked. That was a thing that was evaluated in 2013 and tried out and done on ground in 2015.
That's really wonderful. So any other questions? I think at this point we will, if you have any questions, please communicate either through with Andrew or myself, or Dr. Cariappa has given his email. So please send any questions you have to him, or if you want to follow up on anything. Dr. Cariappa, we really want to thank you very much. This was a really fascinating talk. Lots of very useful information and lessons that you have shared with us. We really appreciate your time. And Andrew, especially you, seeing that it's late night for you, we appreciate the time that you have been on this as well. Thank you to all the participants for taking time out of your busy schedules. And we will keep you updated about new and other webinars that will be coming up. But Dr. Cariappa, again, thank you very, very much.
Thank you so much for the opportunity. Thank you. Thank you, Dr. Melinda.
Thank you. And the webinar will be published online, and we will send more information about that. So thank you very much, and I will then end the session. So Dr. Cariappa,